Morning.
I'm Cornelius Baker. I serve as the special advisor to Ambassador Debbie Burtz, who was here earlier, and also at the Office of Research, NIH. Greg, good morning.
Good morning.
I'm really pleased to be here with you today to talk about Gilead and the work that you're doing in this great partnership with the Washington Post as well. Last week, we celebrated 30 years or recognized 30 years of the World AIDS Day. Gilead is also 30 years old.
That's right.
And so you were born during the most difficult times of the epidemic. And so you've seen the progress that we've made. And that progress across our country has been uneven, and especially in the southern United States, which we want to talk about this morning. What do you see as a company happening in the southern United States, and what are the trends that you're most concerned about?
Sure. So I think a lot of this was discussed by the prior panelists. I think there's been a tremendous amount of progress in the last 30 years. I'm from San Francisco, and we see it dramatically in San Francisco, where over the last 10 years we've seen the HIV infection rates drop by nearly 60%. So there's a lot of progress, but the trends you're seeing in the South is that they're not keeping up, that we're not seeing the same patterns. In fact, you can look at a lot of the statistics of the South that have been talked about, where you have the prevalence of HIV in the United States about 50%, the incidence is about roughly 50%, AIDS-related deaths are about 50%, despite being about a third of the population. So we're not seeing the same gains in the South, and in fact, in many cases, the South is seeing trends of HIV that resemble what we saw in the 80s. And so, one thing that we are really trying to do is ask the question, what are the components of what's been successful in other areas of the country that we need to be doing in the South that aren't happening in the South? And it has to be tailored to the South, of course.
Mm-hmm. And that's really important, and because you talk about what are the other good things, and you talked about the numbers, and we've heard the trends, the statistics this morning, but we don't want to just look at the South as a big deficit.
Right.
And so what are some of the positive things that you're seeing that you think we can build on?
Well, clearly one of the positive things that I've seen, and I've had the opportunity to spend some time in the South recently, are the organizations in the South currently that are doing work. And these are organizations that are working on building awareness, taking on stigma, working on some of the racial and other inequalities that exist in the South, and providing great care. These are some organizations that are very good at understanding their community, understanding what the needs are, and whether it's prevention services, whether it's HIV treatment services, or whether it's dealing with the mental health issues or other issues that are suffered by people living with HIV or at risk of HIV. They're doing a fantastic job. So this is not a capability issue. This is not a lack of expertise. And I would say, if I was to draw one contrast between the South and, say, San Francisco, my hometown, or New York, it's resources. That there are just not as many resources for these really great organizations to capitalize on and really do more of what they're already doing. So we just need to make them better.
Great. And so what do you then think Gilead's role is with those resources and to be part of the solution? We heard from Ambassador Burtz about the great achievements that are happening in DREAMS, and Gilead is a partner in that. So what do you see your role within the southern United States? So
certainly, I think that in terms of what we can be doing, we have to recognize that it must extend beyond access to care. I think Phil Wilson talked about access to care has to be a critical component of this, but we need to really look at making sure that we're more holistic in what we're doing, and we really identify the entire individual, and so we can deal with the issues of stigma, we can deal with the issues of discrimination, we can deal with the issues of other social and environmental factors. And the only way we're going to do that, it's not going to be Gilead doing this. We simply can't. It has to be the community-based organizations. It has to be owned by the communities that are impacted, by the people who live there, who come from there. And like I said before, they they can do this. I've seen this, and they're passionate, they're capable, and what they are going to need is the support. They're going to need some investment, and it has to be a committed investment. You know, this has to be supporting these organizations so they can grow, they can build on what they've already been able to do, and as I said, do more, prevent more infections, treat more people, and provide that comprehensive care to more individuals.
So I know you have a new initiative, and I know that you're putting your money where your mouth is. So can you tell everyone here more about the Compass Initiative?
Sure. So the Gilead Compass Initiative, which we announced yesterday in New Orleans, it's a new initiative. It's a $100 million investment in the South over 10 years. And we've been, over the past several months, planning this out of how we're going to make the impacts that we've been talking about. And we're going to focus on 3 pillars. And the first will be capacity building and information sharing among the organizations that I've already mentioned, and continue to say these guys are really good and they know what they're doing. The second component will be around the individual and well-being, mental health, and trauma of people living with HIV or at risk of HIV. And then the third component, which we think is going to be critical, will be awareness, education, and that key component of stigma reduction in the South. So those are the areas that we're going to be focusing on. Again, working through community-based organizations.
Right, and you've talked about the great skills and strengths of community-based organizations in the South. So who are going to be your partners with this? So
we're going to start off with 3 coordinating centers. And this was through a referral, a RFP process that we ran through. And one partner will be Emory University Rollins School of Public Health. And they'll be working on the capacity building and information sharing. Another organization will be the Southern AIDS Coalition. They'll be working on awareness, education, stigma reduction. And the third coordinating center will be the University of Houston Graduate School of Social Work. And they'll be working on the wellness, the mental health, and the trauma-related issues of those living with HIV. So they'll be the coordinating centers, and they will then actually be deploying the funding through this. So I've talked to a lot of people. We are not going to choose and pick the programs that will be supported. These coordinating centers will be responsible for doing that in the context of the 3 pillars that I mentioned. So they will be out there and identifying who the champions are and really, again, making them better at what they do and delivering on what we want to accomplish.
Oh, that's great. And full disclosure, I'm a lecturer at Emory, and they're very excited. And so we're very thrilled to be a part of this. You know, earlier, Lenny asked Dr. Fauci and Ambassador Birx, what do they see in 5 years? Now, you have a 10-year initiative. How do you hope the world, how do you hope the Southern United States, how do you hope for people in that region? What's going to be different for them?
Well, we hope that I kind of keep repeating this, that the first thing that we want to see is these organizations not only be sustained, but grow and build upon what they've already done and be able to provide the care and services for those in the South who may not be aware of where those services are, may not be aware of the latest in prevention of HIV and have places to go. And then over time, I mean, it's very simple. We want to see the South enjoy what other cities have enjoyed, which is, you know, really working towards 0 new infections, 0 AIDS-related deaths, and we need to eliminate stigma in the South. So those are big goals, and you know, we're gonna. I'm a positive person, and I'm actually very confident. I have a lot of confidence that not Gilead, but these groups can do this. And so we're going to invest in them, and we're going to commit to them. And that's what we'd like to see is fewer people with HIV and fewer people dying of HIV, and we've got to get rid of that stigma.
Great. We have a minute left, and I guess, you know, we focused on the Southern United States. Gilead is both a national and global company. And I guess, you know, reflecting on World AIDS Day and your 30 years, and, you know, I met your founders when they were starting out at Gilead, and particularly Michael Reardon, and thinking about his hopes and dreams. What do you think about Gilead's hopes and dreams right now? It's a company that's been so invested in HIV. What would you like to see?
Okay, in the 20 seconds I have left, so just for everybody here, Cornelius and I, most of the conversations we've had around HIV/AIDS have been for Sub-Saharan Africa and Southeast Asia. So But our goals are very simple. We want to have better medicine for people with HIV. We want better prevention for people at risk of HIV. And we want those tools to go out there and make the impact that they need to have. That means people need to have access to the medicine, they need to have access to the prevention, and they need to have organizations on the ground that understand how to deliver that to them. And then we need to get to the easy answer is we need to have no new infections. Everybody needs to be virally suppressed. And we need to, make sure that the HIV community is embraced by the communities they live in. So we need to get that 90-90-90 or more. And we need to have a cure for HIV. We need to have a vaccine. All those things we'd love to see.
Great, thank you.
All right, thank you.